Good morning and happy Friday. Welcome to the second and final Love Your Liver Black History Month community event. This event is hosted by Blue Fairy, the Adrian Wilson Liver Cancer Association. Blue Fairy's mission is to prevent, treat, and cure primary liver cancer, specifically hepatocellular carcinoma, through research, education, and advocacy. Blue Fairy's Love Your Liver program spreads awareness and educates underserved populations to increase the prevention and early detection of liver disease and cancer. Thank you for attending today to learn about how liver cancer affects the African American community. Today we have an expert gastroenterologist and liver cancer researcher, Dr. Lewis Roberts, who will discuss liver cancer risk factors and how to care for your liver. At the end of the presentation, we will have a Q&A session with Dr. Roberts. To submit a question, click on the Q&A icon at the bottom of your screen. Type your question and click Send. Feel free to submit questions anytime during the presentation, but we will not answer questions until the Q&A session. We apologize in advance because we may not be able to answer every question. Please note, this is an educational presentation, so please ask general questions and don't share your personal health information. Dr. Roberts is not your personal doctor and cannot provide a personal medical consultation during this event. We also like to have your participation in this webinar by putting and using your reactions. You have a little emoji icon button on your screen. Go ahead, if Dr. Roberts says something that resonates with you, information that maybe you weren't aware of, a light bulb goes on, feel free to react with an emoji or a thumbs up or an attaboy. Dr. Roberts and our audience appreciates it. There will be poll questions throughout this presentation, and we encourage everyone to participate. Please join us when the questions pop up on your screen. We thank you in advance for your participation and cooperation. If you experience any technical difficulties throughout the event, contact our host, Andrea, in the chat section. Dr. Lewis Roberts is a gastroenterologist at the Mayo Clinic in Rochester, Minnesota. He is a professor of medicine at the Mayo Clinic College of Medicine and Science, specializing in providing care for patients with chronic liver diseases. He has extensive expertise in the diagnosis and multidisciplinary management of benign and malignant liver masses, including hepatic adenomas, hepatocellular carcinomas, bile duct cancers, and gallbladder cancers. His passion in his research is helping advance individualized medicine, which would allow the effective treatment of cancer with minimal side effects. So let's dive into our first poll question about liver cancer's effects on the Black community. Black Americans are more likely than the general population to get liver cancer. How much more? 30%, 65%, 80%, 100%. Even if you're a little unsure, feel free to respond. We'll give it a few more seconds. Excellent. Thank you for joining us, Dr. Roberts. Please tell us the correct answer.
Thanks very much for the opportunity to present. So Black Americans are about 80% more likely to get liver cancer than the general population. So that's almost twice as likely to get liver cancer as the general population. And what we'll be doing during this talk is to discuss some of the reasons why and what we can do about it. So we'll discuss today what's the liver and how it works, how common is liver cancer, the risk factors for liver cancer. We'll talk about liver cancer screening for early detection. We'll talk about some of the available treatments and steps that you can take to protect yourself and your family so as to prevent liver cancer or on the other hand, to detect it early so it can be treated when that treatment is most effective. And we'll talk about some of the treatments for the later stages of liver cancer as well. So what's the liver? The liver is the largest organ in your body. It sits in the top right part of your belly under your ribs. So it's kind of hidden away. And so most of us are completely unaware of our liver. The liver is busy working for you. It does about 500 different jobs for your body, all the way from getting the nutrients that are absorbed from your intestines and processing them to making different types of proteins that are important for keeping your body functioning well and detoxifying toxins that you ingest in the food or that enter your blood in different ways. So lots of work that it's doing. In part, we think because it's exposed to toxic chemicals from the outside, it's the only organ inside of you that can regrow itself almost completely. So if it's injured, it can regrow itself so that it's able to be ready to tackle the next type of injury or toxin that's presented to it. And so in many ways, the liver is your body's filter. It removes toxins. And then as food materials come that are absorbed from the intestines, it breaks down the fats and cholesterol into their component parts. And it can ship those parts out through the blood so that they can go to other organs and be used for making up the substance of your body or as energy sources. Similarly, it also breaks down the carbohydrates, the carbs, and proteins that you absorb and distributes them throughout your body. So how common is liver cancer? Liver cancer is on the rise in the United States. Between 2000 and 2019, it was increased about 34%, so increased by about a third the number of people that develop liver cancer in the United States every year. This year, about 41,630 Americans are estimated will get a liver cancer diagnosis this year. And almost 30,000, 29,840 Americans are estimated to die from liver cancer this year. So it's an increasing cause of death from cancer in the United States. There are different types of liver cancer. Primary liver cancer is cancer that begins in the liver. In adults, the types of primary liver cancer include hepatocellular carcinoma, which is the commonest of the primary liver cancers, which is derived from the liver tissue cells themselves, or what we call the hepatocytes, that do a lot of the liver functions. So more than 80% of primary liver cancers are hepatocellular carcinomas, and much of our discussion today will be about these cancers, or what we abbreviate as HCCs. There are also biliary tract cancers or bile duct cancers that occur within the liver. And the bile ducts are the ducts that collect the bile that's made by the hepatocytes. They process it, they deposit it in the gallbladder. When we eat particularly fatty foods, the gallbladder contracts and the valve where the bile ducts enter the intestines opens, so the bile can be spilled into the intestines to help with digestion of fats. And so that other cancer is called cholangiocarcinoma. We won't focus on it today. It's the less common primary liver cancer. So specifically talking about liver cancer in Blacks and African Americans, as we've said, hepatocellular carcinoma is the most common type of liver cancer, and the number of people in the Black community getting hepatocellular carcinoma or HCC is growing. And as we mentioned, liver cancer is about 80% more likely in Black Americans compared to the general population. So this results in the highest death rate from liver cancer in any ethnic group. And in addition to this, Black Americans are less likely to be diagnosed with early stage liver cancer. And as I mentioned earlier, early stage liver cancer is much more effectively treated than late stage liver cancer. So we want to be diagnosing more people with early stage liver cancer. It's important then to that education and taking control of your health, of our health, can help us manage liver cancer risk. And so we'll talk about some of the things that we can do to reduce these risks. So in terms of risk factors for liver cancer in Blacks or African Americans, well, first of all, describe what's a risk factor. It's a reason why someone is more likely to get a disease than the average person. And some of the common risk factors for liver cancer include medical conditions, lifestyle choices, and ethnicity. And as we've mentioned, for example, we talked about the fact that Blacks and African Americans are more likely to get liver cancer. And this is related to ethnicity. And of course, ethnicity relates not only to genetics or inherited risk, but also to the circumstances within which we live, the influence of the environment within which we live. So this takes us to our next poll.
Excellent. Thank you, Dr. Roberts. So for poll question number 2, we'll review some of those risk factors. Which of these risk factors for liver cancer? Hepatitis C, type 2 diabetes, being Black or African American, all of the above. We'll give you a few seconds to respond. All right, Dr. Roberts, please tell us what the correct answer is.
So it's all of the above. So hepatitis C is a form of chronic viral hepatitis. HEPA relates to the liver, and itis relates to inflammation. And hepatitis C is a virus that infects the liver. And so hepatitis C virus is a major cause of liver cancer. Type 2 diabetes is part of what we call the metabolic syndrome of diabetes, hypertension, high cholesterol, or hyperlipidemia, that all work together and they can cause injury and inflammation in many parts of our body. And then, as we've mentioned before, being Black or African American by itself is associated with increased risk of liver cancer. So we'll talk broadly about some of the other risk factors or different risk factors for liver cancer. So the first is hepatitis B virus, or we abbreviated Hep B. Blacks and African Americans are 2.6 times more likely to die from hepatitis B than non-Hispanic white Americans. Hepatitis B is a virus that's transmitted through the blood or body fluids. It can be transmitted from an infected pregnant mother to her infant during childbirth, or infected family members in early life. So often people in other countries acquire hepatitis B at birth or in the early parts of life. In the US, it is most commonly transmitted through sexual contact. It can also be transmitted, of course, through the blood. And so if people share needles, they can also acquire hepatitis B virus infection. Now, hepatitis B virus can eventually lead to cirrhosis, which is when scar tissue replaces healthy liver cells. We talked about how the liver can regenerate itself. And much of the time, if you get just one injury to your liver, you'll find that the liver heals. It heals itself to become completely normal looking. It's a little bit like when you cut your skin. Typically it'll heal, and you cannot even tell that there was an injury there. But if you have chronic infection with hepatitis B, the hepatitis B isn't going away, and it keeps injuring the liver on and on and on. And it's like as though you had an area where you cut yourself, but then when it healed, you cut yourself again, and then you cut yourself again, and then you cut yourself again. Eventually, you're going to have a scar that forms that you can see, and it's similar in the liver. Eventually, it wears out its ability to replace itself, and scar tissue begins to form in the liver from chronic hepatitis. So cirrhosis increases your risk of liver cancer because all that damage occurring within your liver is reflected in damage to the liver cells, to the liver cell DNA, and the changes in the liver cell DNA lead to development of liver cancer. But hepatitis B is unique in that it's a DNA virus, just like your DNA. And when the DNA in your liver cells is damaged, hepatitis B can insert itself into that DNA and become part of your normal liver DNA. So now it can disrupt your normal liver DNA, and you can actually develop liver cancer without first having cirrhosis. So hepatitis B causes liver cancer in people with cirrhosis, but also in people without cirrhosis. So it's important to ask your doctor to screen you through a blood test for hepatitis B if you've never been vaccinated or tested that you know it. And that's just a key part of making sure that you are aware of your risk factors. And the US CDC actually currently recommends that every adult should receive testing for hepatitis B virus infection at least once in their lifetime. Next is hepatitis C virus. We mentioned that earlier. This is one of the leading risk factors for liver cancer in the United States. And Blacks and African Americans are almost 2 times as likely to die from hepatitis C compared to white Americans. Like hepatitis B, hepatitis C virus is passed through blood and body fluids. And diagnosis of hepatitis C is very important because we now have medications available that can cure the virus and cure it really effectively in over 95 to 98% of people who are treated. These medications are pills with minimal side effects and are generally taken for about an 8 to 24-week period, depending on your individual situation. And as I mentioned, they are more than 90% effective in curing the virus. So it's really important. Again, the US Centers for Disease Control and Prevention recommends that all adults should be screened for hepatitis C virus. And if you have or have had hepatitis C, it's important to ask your doctor to screen you for HCC because it's such a common cause of HCC in the United States.
Which leads us into poll question number 3. Black Americans are more likely than non-Hispanic white individuals to die from hepatitis C. How much more? 10%, 43%, 88%, 120%. Dive in. We'll give you a few seconds. All right, Dr. Roberts, please tell us what is the correct answer.
So the correct answer is 88%. So that means that it's about 188% compared to the non-Hispanic whites being 100%. So Black Americans are almost twice as likely to die from hepatitis C as non-Hispanic white individuals. More risk factors. We talked about type 2 diabetes. Now, Black Americans are about twice as likely to get type 2 diabetes as the general population and have more complications of type 2 diabetes than the general population. And type 2 diabetes, as I mentioned, is linked to an increased risk of liver cancer. It's associated with what we call the metabolic syndrome of obesity and hypertension and high cholesterol or hyperlipidemia that work together to increase inflammation in the body and increase our risk of liver cancer.
Let's go to poll question number 4. Is type 2 diabetes an independent risk factor for getting liver cancer? Yes or no? Few more seconds. All right, Dr. Roberts, please tell us which is the correct answer.
So yes, indeed, type 2 diabetes has been shown to be a direct risk factor for liver cancer. And so an important thing to know and important to recognize because it's not something that I think many of us think about, that you have a family member of type 2 diabetes. It's not, we tend to think, well, they might have problems with retinopathy or eye disease. They might have problems with kidney disease. We don't often think that they're at risk for liver cancer. And so it's important that we recognize this as a risk factor. And diabetes, of course, is often associated with obesity. And obesity is associated, as we mentioned, with type 2 diabetes and metabolic liver disease or fatty liver disease, both of which are risk factors for liver cancer. And you can see here that body fat percentages for men that are greater than 25%, or for women that are greater than 33%, are associated with increased risk of liver cancer. There's also what we call the body mass index, which is a ratio of your weight to the square of your height. And what the body mass index does is it separates people who are normal weight from people who are obese, and that's usually between 30 and 39.9 kilograms per meter squared is the index, compared to those who are moderately obese or who have what we call medically complicated obesity. And that's people who have a greater than 40 kilograms per meter squared. So it's really important to know your body fat percentage or your body mass index, because knowing these gives you a sense of your risk, and you can work with your doctor and your healthcare providers to manage or limit your risks from obesity. So diet can be a positive or a negative contributor to the risk of liver cancer. So if you have a diet that's full of red meat, such as smothered chops, and high-fat sides, such as collards cooked in bacon fat or candied yams, that may increase your risk of becoming overweight, leading to type 2 diabetes. On the other hand, a diet that's full of fruit, vegetables, and whole grains, such as brown rice and oatmeal, nuts, beans, and fish, may help reduce liver fat, even if it doesn't reduce your actual weight. And of course, for many people, it will reduce your actual weight, and of course, that's a benefit as well. So there's a number of lifestyle choices also that are associated with liver cancer risk. One of them is alcohol. Alcohol is in many ways kind of like fat and the diet that causes obesity, except alcohol by itself can induce damage to the liver, and it can increase the amount of fat that's deposited in the liver as well, which further contributes to liver damage. Sharing needles, of course, a lifestyle choice that, again, because we talked about viral hepatitis B and hepatitis C both being able to be transmitted through the blood, sharing needles increases a person's risk of developing liver cancer as well. And smoking, like for many other cancers, is associated with an increased risk of liver cancer as well. In studies, smoking up to doubles your risk of liver cancer. And so anything that we can do to mitigate or reduce these risks through these lifestyle choices will reduce our risks of liver cancer.
Diving into poll question number 5. Is being part of a certain ethnic group a risk factor for getting liver cancer? Yes or no? I'll give you a few more seconds. That's a meaty one. All right, we'll wrap it up. Dr. Roberts, please tell us which is the correct answer.
The correct answer is yes. Certain ethnic groups have a much greater risk of getting HCC or liver cancer. And this, of course, ties into sometimes their environmental exposures that are associated with being a part of a certain ethnic group. And so as we've talked about, we'll just summarize here, it's important to know our risks and take action. Type 2 diabetes, take action by getting your blood sugar under control. Hepatitis B infection, despite the lack of an absolute cure, it's possible to manage hepatitis B infection. There are medicines that can suppress the level of the virus in your body that will reduce your risk for cirrhosis and liver cancer. So it's important to be evaluated and to get care. Hepatitis C infection, again, can lead to liver cancer at early stages of liver disease. Hepatitis C is treatable and may be curable for almost all people. So again, important to know your status and be treated. Diet and obesity, it's really important that we reduce the amount of red meats, high-fat dairy products, and processed foods, and pivot to using more fruit and vegetables. Those are much healthier. In terms of alcohol, the recommendation from the CDC, you may have seen recently there was a recommendation from the CDC that we should actually reduce alcohol use, because there's clear evidence now that alcohol use is associated with development of multiple cancer types. but specifically for liver cancer as well. And so it's important that we have no more than a drink a day for women and no more than 2 drinks a day for men. And if you can reduce your alcohol use even lower than that, that's wonderful. Needle sharing, we talked about used IV needles. It's important to realize that unsterilized tattoo or body piercing needles can also increase the risk for hepatitis C virus infection. So needle sharing is an important risk factor. Smoking is an important risk factor, so please talk to your doctor and other healthcare professionals about resources to help you quit smoking. And being Black or African American is associated with independently with risk of these conditions. So it's important to get educated on your risks and get tested. So work with your doctor, get tested, get your risk factors under control. It will substantially reduce the likelihood of you getting liver cancer. So how do we diagnose liver cancer? There's a number of different ways. There's laboratory tests that we can do, imaging tests that take pictures that we can use, and there's biopsies that can be taken to help diagnose liver cancer. In terms of the laboratory tests, a number of these tests help us to understand if a person has liver disease and how severe it is. So a complete blood count, for example, includes a platelet count, and people who have severe liver disease often have a low platelet count. So if you have a blood test done and you see that the platelet count is lower than normal, you might want to check with your doctor and say, how do we explain this change? In a comprehensive metabolic panel, you often have different tests that look at the levels of liver functions. And so there's the bilirubin test, for example, that studies how well bile is cleared from the body. There's the transaminases or aminotransferases are enzymes that are present in liver cells. So when the liver is injured, these enzymes leak out into the blood. And it's important that we know about this because that's often the first sign that a person has a problem with their liver. And then there's the hepatitis panels that test for hepatitis B and hepatitis C in the blood and allow us to identify those diseases. And beyond that, there are the tumor tests, such as the alpha-fetoprotein or AFP. And when we have a person who has cirrhosis who is at risk for liver cancer, we will recommend that they have one of these blood tests, the tumor tests, every 6 months. If the AFP is normal and then starts rising, we know that it's important to check into that just to be sure that we are not seeing the early stages of liver cancer develop in an individual. In addition, we can do imaging tests. So in addition to doing the blood tests, such as the AFP every 6 months, we will often do an ultrasound scan of the liver every 6 months as well to help us identify liver cancers when they are small. And then the way we confirm that this is likely a liver cancer is by doing a CT scan or an MRI scan. So CT scans use X-rays, MRIs use magnetic resonance to image the liver, and we can look to see if there's small tumors. And usually the doctors will put some dye in your veins when they do these scans, because the way in which the dye flows through the liver will give an indication whether a spot that they see in the liver is likely to be a liver cancer or not. And so if we find a suspicious spot in the liver, sometimes the CT or MRI is enough information that we can move forward to think about treatment, such as with surgery. But if there's not enough information from the imaging, then often we ask for biopsy. And these are with fine needles or core needles, which are a bit larger than the fine needles. We get a core of tissue. The pathologist can examine this to see if they see evidence of liver cancer. We can also do a laparoscopy where a surgeon puts a telescope in the abdominal cavity. They can look at the surface of the liver. They can use an ultrasound probe to see if there's an area of the liver that's abnormal, and they can try to biopsy the spot to get tissue. In addition, once we get tissue, we can do tumor mutation testing to see what are the underlying pathways or growth signaling pathways in the liver that led to the development of this tumor. And those can help us to guide the treatment that a person receives for their cancer. So it's important to recognize that a cure is completely possible if liver cancer is detected early and removed by surgery. And if you have risk factors, it's important to talk to your doctor about being tested regularly so that if you have those risk factors, we can identify cancer at the earliest possible stage and have a chance for cure of the cancer. So how do we determine the stage of liver cancer? Doctors often will try to figure out how serious a cancer is through a process called staging. So staging involves two important factors. We know that in liver cancer, there's the tumor to deal with, but there's also the fact that many people with liver cancer have an underlying liver disease that has affected their liver function. So in terms of the tumor, doctors will look at the tumor size. They'll look to see if the cancer has spread outside the liver to bones or the lungs or lymph nodes, and if it has spread, where in the body it has spread. But they'll also look at the liver function to see whether it's near normal, which they call class A liver function, to see whether there are moderate abnormalities, which we call class B, or whether there are severe abnormalities, which we call class C. And people with class C cirrhosis are often too sick for surgery or other major cancer treatments. But even if people have class C cirrhosis, if they have liver tumors that are the right size, that are early stage, they may be able to qualify for liver transplant for cure. So people with class C cirrhosis often get transplanted if just for the severe liver disease. But again, if you have class C cirrhosis and you also have a liver cancer, that may be a reason for a transplant. And so here we sort of summarize the stages of liver cancer and how we treat them. For early stage, it's treatable by resection, transplantation, or ablation. Resection is when a surgeon goes in and removes that section of the liver. Transplant is when we take the entire liver out and replace it with a liver from someone who's deceased, or a portion of the liver of someone who's living, so a living donor, we call it, might give half of their liver to be inserted into another person to allow them to live with good liver function, similar to how it happens often with kidney transplants. Or we do ablations, and ablations are when we put a probe in the tumor that's in the liver, heats the tip of that probe, and that basically cooks the tumor and renders it unable to spread or grow. When we have intermediate stage tumors, often these are not resectable, so they may be too large to remove surgically, or they're not technically feasible to remove from the liver, but they're still limited in their degree of progression. So this is liver cancer that has not spread outside the liver, but is unable to be removed with surgery. In the sense, it's unresectable, and it's unlikely to be able to be treated with a liver transplant. So patients with intermediate stage disease, we often treat with methods that involve using the arteries. We put little catheters into the arteries that go to that portion of the liver that has the tumor. We can block off the blood supply to the tumor using plastic beads, or we can insert radioactive beads into that area, and that the radioactivity then acts on just that narrow area and destroys the tumor tissue. And sometimes using these methods, we can actually shrink a tumor to the point where that person then becomes a candidate for liver transplant. So even intermediate stage disease, if we find it, there's a chance of what we call downstaging and making the patient a candidate for liver transplantation. And finally, the advanced stage is liver cancer that has spread to the lungs, bones, lymph nodes, or other organs. Typically, a treatment to cure the cancer is not possible, but especially with some of the newer agents we have, such as what we call the immune checkpoint inhibitors or immunotherapy, it's possible that liver cancers can be controlled for a long time. So again, it's important that we make that diagnosis early enough that we can attempt effective treatments against the cancer.
For poll question number 6, we want to know what you think. What are some reasons liver cancer cannot be treated with surgery? Choose one of the following. Cancer has spread throughout the liver. The tumor can't be removed because of where it is in the liver. Patients are not healthy enough to have surgery. Patient refuses surgery. Or all of the above. Another meaty one. We'll give you a few seconds to answer. One more second and we'll wrap it up. All right, Dr. Roberts, please tell us what the correct answer is.
So our answer is all of the above. And so for some people, cancer may already have spread throughout the liver when we detect it. And so in that case, it's really difficult to treat it with surgery because, of course, we can't remove the entire organ. And what we find in those cases is that the likelihood is also that even if we don't see evidence of obvious spread outside the liver, there may be cells from the tumor, what we call circulating tumor cells, that are already in the blood. So that if we were, for example, to try to do a liver transplant in a patient that has cancer throughout the liver, we remove that liver and put a new one in, it's possible that tumor cells that are in the blood might come back to the liver, repopulate it with tumor, and the tumor grows back relatively quickly. So there's points beyond which we can't safely do a transplant because of spread throughout the liver. And then the tumor may not be possible to be removed because of where it is in the liver. You know, the liver towards the central part of it has lots of the bile ducts and the blood vessels, the arteries and the veins that are passing through that region. And those are critical organs, so to speak, or critical parts of the liver that are needed for the rest of the liver to survive. So if you have a tumor that's right up next to or it's engulfing one of these key arteries or veins, it may be impossible to remove it because of its location. Some patients are not healthy enough to have surgery. We talked about people with what we call child Pugh class C cirrhosis, the staging of the cirrhosis. When people have the most severe forms of liver disease, they may not be healthy enough for surgery. But people may not be healthy enough for other reasons. They may have end-stage diabetes with kidney disease or heart disease or lung disease, and all of those things might make them not healthy enough to have a surgery. And sometimes patients will refuse surgery even when surgery is feasible. And of course, this has a lot to do with understanding and awareness of the disease, the potential for treatment and the potential for cure. And so I think part of this work that we all can do is educate ourselves about liver cancer so that when surgery is feasible and actually looks like it's going to be safe, people are more likely to say, yes, I would like to have surgery. So we'll go again here through some of these early stage treatment options that we've described. And we talked about the fact that when liver cancer is caught early, there's a chance for a cure. Early stage local therapies are surgery or ablation. Talk about surgery to try and remove all the cancer. Transplant as a type of treatment where the liver is removed and the donor's liver is put in its place. Ablation as a treatment done by a radiologist that can cure small liver cancer tumors when patients are not good candidates for surgery or transplant. It's really important to remember if you have one of these treatments for early stage disease, to remember that liver cancer can come back, particularly with surgery and ablation, where we are only removing part of the liver. It's important that we recognize that the remaining liver still may have hepatitis B virus in it, or still may have cirrhosis in it, or injury to the liver. And so you can develop new nodules of the liver Maybe they had spread from the first cancer, but were not evident at the time of surgery, or a new cancer can develop in another part of the liver. Really important to go back to your doctor on a regular basis to be checked so that these liver cancers, new liver cancers, can be identified and treated when they are small. If we do this effectively, people can live a long, long time with finding small lesions, treating them effectively, and then continuing to monitor them. And initially, we'll often monitor people every 3 months after they've had a treatment. The second year, we might go to every 4 months. But usually, we won't go more than every 6 months. So it's important to keep that repeated checking. So in the intermediate stage, typically we can't use surgery. And as we described earlier, we can do embolization type treatments. This is when we inject substances like plastic beads into the blood vessels that supply the tumors, or we can inject also radioactive glass beads into the blood vessels that supply the tumors. The other thing that we can do is we can focus radiation therapy beams on the tumor within the liver. So there's something that we call stereotactic body radiation therapy. Some of you may have heard about gamma knife therapy that we use for brain tumors. So the stereotactic body radiation therapy or proton beam therapy are similar to the gamma knife. They focus the radiation on the tumor so that they can kill the cancer cells while sparing damage to the surrounding liver.
Poll question number 7 is a quick review. There are no treatments for advanced liver cancer. True or false? Few more seconds to answer. We'll wrap it up. Dr. Roberts, please let us know what the correct answer is.
It's false. There are actually an increasing number of medications for advanced liver cancer, and some of them may have a really durable effect. So this is really the good news. While 80% of HCC tends to be diagnosed at a stage that's too advanced for local therapies, as I mentioned, we have good treatments for intermediate stage therapies, and developments continue in the treatment of advanced liver cancer. We call this systemic therapy. That's treatment that you take either through a pill or it's infused through a vein into your blood, and it works throughout your body. We have targeted therapies. These are drugs that focus on certain pathways in cancer cells to block the ways that they grow and divide or move from one place to another. And then there's immunotherapy, which is treatment that tries to make the body's immune system stronger. And I characterize the immunotherapy as sort of like the shields that they talk about in Star Wars, when you have a spaceship or a starship, and when they have incoming damage or an incoming rocket from another ship, they throw up these shields to prevent the rocket damaging the starship. Well, that's what cancers do. Cancer cells throw up shields around themselves to block damage from the immune system. And the typical immunotherapies we have, or what we call immune checkpoint inhibitors, dissolve those shields away. So the immunotherapies will dissolve the shield that a cancer cell has put around itself so that the immune system can attack the cancer and destroy it. So these are proving to be very effective in about 20% of individuals with advanced liver cancer. And there's lots of work going on to try to extend their effectiveness to other patients as well. So if you've been diagnosed with liver cancer, don't lose hope. Even if you've been diagnosed with advanced liver cancer, there are FDA-approved treatments. It's important to find doctors that specialize in liver cancer to help you determine the best options for you. Find the medical oncologist who specializes in HCC or liver cancer. Find a hepatologist, that's a doctor that's a specialist in the liver. You'll often be referred to a surgical oncologist, that's a surgeon that specializes in cancer treatment, or a transplant surgeon, or to an interventional radiologist that does the ablations we talked about, or a radiation oncologist that does the focused radiation treatments with stereotactic body radiation therapy or proton beam therapy. So there's lots of options. Don't lose hope. And it's important to do our self-care then when diagnosed with liver cancer. And in addition to working with liver cancer specialists, you can manage your weight by paying attention to your appetite and tracking your weight. Track your energy so that you can work around times when you feel tired. Eat a healthy diet, drink lots of water to stay hydrated. Most importantly, ask for help when you need it. There are resources available to help you navigate this journey, but you must let your doctor know what you need. And asking for help when you need it is critical to self-care. So let's recap. It's important that we know our risk factors and share what we've learned about risk factors with our family and community. It's important that we make healthy choices. Obesity, poor diet, and unmanaged type 2 diabetes may lead to liver cancer or other health problems. It's important to take action. Make an appointment to see your family doctor. Get your physical every year. If it turns out that you have risk factors, see with a doctor with experience treating liver disease and liver cancer to be screened. And know your options. Even if you've been diagnosed with advanced liver cancer, you have options, and a specialist can help figure out which course of treatment is best for you. And keep in communication with your doctor, following your doctor's treatment plan, and keep notes so that you can discuss the side effects with your doctor and come up with a plan for how best to manage them. And just again, to remind you, you can learn more about liver cancer at loveyourliver.us. Thanks very much.
Thank you, Dr. Roberts. For our final poll question number 8, we're going to present a challenge to you. After this presentation, will you make an appointment with your doctor, get screened for liver cancer, tell others about this information, or all of the above? We'll go ahead and wrap up that poll question. And we do hope that you will take the information you've received and do something with it. It's important that we work and use the knowledge that we have. So thank you, Dr. Roberts, so much for the knowledge you've shared.
Thanks very much.
We would be remiss if we did not thank our generous sponsors, AstraZeneca, Merck, Bristol-Myers Squibb, and Genentech. We will begin the Q&A session soon, so if you still have not submitted a question, please do so in the Q&A session. All right, we're going to dive into our Q&A section now. Here is our first question. What is a fatty liver and what causes it? How is it diagnosed? What can one do to reverse it? And does it increase your risk for liver cancer? Dr. Roberts, what's your response?
Just a second here. Let's just clean up I'll stop sharing. Okay. Thanks for the question. I think the idea here is that certain conditions can lead to excess fat being deposited in the liver. And one of the commonest condition, of course, is obesity. So if we are overweight, we have fat that's deposited in our muscles, in our subcutaneous tissues, in other parts of our bodies. And the liver is no exception to this. Excess fat can get deposited in the liver. When excess fat gets deposited in the liver, it actually pushes aside the normal structure of the liver cells and forms like a little vesicle or a bleb within the liver cell. So it interrupts the way the liver functions. And fat also generates what we call reactive oxygen species. And so these are compounds that damage the DNA in the cells. And so the consequence of having fat in the liver is that we get damage to the DNA, and that can eventually lead to the development of a cancer in the liver. So that's, the fatty liver, and the fatty liver, as it causes damage, also can be replaced by scar tissue and give us cirrhosis. So I hope that sort of answers the question.
Thank you, Dr. Roberts. Next question. What can we do to keep our liver healthy? Should we request a liver test to be done during a wellness checkup? This is never discussed, and it seems it should be. I agree. What's your response, Dr. Roberts?
Yes, I really encourage people to, at the very least, ask their doctor to test them for the things that the CDC recommends that all adults be tested for. And so the CDC recommends that all adults should be tested for hepatitis B virus infection and hepatitis C virus infection. So if you don't know that you've been tested, that's a national recommendation. Please ask your doctor to be tested. Beyond that, I think it's really important to think about whether you might have any of the risk factors that are associated with either the viral infections or with the metabolic disease such as diabetes or obesity, hypertension, hyperlipidemia, or high cholesterol. So if either yourself or a family member has any of these conditions, that may mean that you are at risk for these conditions as well. And so it's really important that you ask your doctor then, boy, I have these conditions. I wonder if they might be affecting my liver. So that, and ask if you might be able to have a screening test of your liver function. A lot of the time, people first find out that they have a problem with their liver because they go and have an insurance physical. Because your insurance company will often do a panel of tests to assess your health. And one of the tests that they'll do is a series of liver tests. And so it's not uncommon for patients to say, well, I did this insurance physical, and I found out that I have a high liver test, and the insurance company asked me to go see my doctor. But I think we don't want to wait for an insurance physical to do that. Ideally, as an adult, if you have any suspicion that you have risk factors, please ask your doctor if you can be tested for liver disease.
Thank you, Dr. Roberts. The next question. How and why does type 2 diabetes increase your risk for liver cancer? Is this still a risk factor if you have diabetes under control with metformin or other medicines? What say you, Dr. Roberts?
It's a great question. I think diabetes broadly is a risk factor. Of course, if you have the better your control over your diabetes, the lower your risk. But I think even when diabetes is controlled, it does remain a risk factor because many people with diabetes, even under care, will find that they have evidence of fat in their liver, and they have evidence that the fat is causing damage to the liver. We did an interesting study in Ghana, in West Africa. Of course, that's a majority Black population. And we tested diabetics to see if they had, what proportion of them had fat in their liver. And a full 50% of the diabetics that we tested had fat in their liver. And then we asked the question, what proportion of individuals had scar tissue, evidence for even early stage scar tissue formation in the liver, and it was 8%. So almost 10% of diabetics that we just recruited from a diabetes clinic already were showing signs of liver damage from the effects of the diabetes.
Excellent. Thank you so much for that answer. If a person has a genetic predisposition or they know it's in their family for liver cancer, would it benefit that person to have genetic testing to see whether they are at risk? What do you think, Dr. Roberts?
That's a great question. There are a few genetic tests that we know of that are associated with risk of cancer generally. And when we test people with liver cancer, we find that somewhere between 5 and 15% of individuals with liver cancer had an abnormality in one of these known cancer-causing genes. And so I think it's worth having a discussion. If you have a strong family history of liver cancer, it's worth having a discussion with your doctor about whether it's a wise thing for you to talk to a medical geneticist to see if you should be tested for these known cancer-causing genes. And if, of course, if you have a family member that's already been shown to have one of these known cancer-causing genes, then it might be even more important to be checked for it, because then, your doctor and the geneticist might come up with a plan for whether you need to have enhanced screening for cancer.
Here's another question about fatty liver. Is it true that fatty liver disease can develop in a person who does not drink? What do you think? What do you think, Dr. Roberts?
Absolutely. And so, what we actually, the new name for fatty liver disease is metabolic dysfunction associated fatty liver disease, or steatotic, that's fat liver disease. But the old name was non-alcoholic steatohepatitis. And this name was developed, or this name was coined because a group of doctors here at the Mayo Clinic, this is many years ago now, were seeing patients who looked, for all intent and purpose, like they had fat in their liver from alcohol use, but they claimed that they were not using any alcohol. And initially it was, well, a little bit of disbelief, maybe they're closet drinkers and they're not admitting to drinking. But it turned out that indeed these were people who were not drinking, and it was, the association with diabetes and hypertension and high cholesterol that was leading them to deposit fat in the liver. So you can have fat in the liver without alcohol.
We'll take a few more questions. Thank you, Dr. Roberts. Here's the next one. Is BMI accurate for Black people?
That's a great question, and it raises the question about the importance and the value of the BMI. So BMI generally gives us an idea of what a person's weight is in reference to their height, and they square their height. But it's important to recognize that for many people, they can have different body shapes. So for example, we talk about the fact that some people have a pear-shaped fat distribution in their body, so that their upper body is actually kind of thinner, and their lower body and their hips is where they can tend to deposit fat. People with a pear-shaped body distribution tend to have less risk of fatty liver disease than people with an apple-shaped body distribution, where most of the fat is around their trunk and their abdomen. And so it's really important that we consider also the idea of waist circumference. And there are also measures of waist circumference where you measure a person's waist circumference, and that is something that you pay attention to, because their BMI may be the same as someone that has a pear-shaped distribution, but because of having a big waist circumference, they may be at increased risk of fatty liver disease and liver disease generally. That's a great question.
Thank you, Dr. Roberts. And our final question. What type of tests do doctors look at to determine the health of our liver? What testing can be done to find out why liver enzymes are elevated? Dr. Roberts, what's your opinion?
Great question, because there's a number of different things that can cause elevations in liver enzymes. We've talked about the common ones, which are the viral hepatitis B and C are the chronic diseases, but of course, viral hepatitis A is an acute disease that people can get that has increased liver enzymes, and there's a viral hepatitis E that also can occur and be associated with increase in liver tests. And we've talked about fat in the liver, and we've talked, and that's fat from the obesity and diabetes, metabolic dysfunction, and we've also talked about alcohol. But the less common causes of increased liver tests are things like gallstone disease, which can result in the bile ducts being obstructed. When the bile ducts are obstructed, the pressure of the bile goes into the liver, and you can get liver damage and increased liver tests from that. You can have other diseases that are autoimmune diseases in the liver that we call primary biliary cholangitis or primary sclerosing cholangitis. And these are diseases that affect the bile ducts, are also associated with increased liver tests. There are also diseases that are due to inherited genetic conditions such as hemochromatosis, which is an iron storage disease. Hemochromatosis results in excess iron in the liver, and it can be associated with increased liver tests. So a number of different conditions. And so what doctors will typically do if someone presents with liver disease is test for a panel of these things. They might test for the common things first, but if those are negative, then they'll test for the uncommon diseases as well.
Well, thank you so much, Dr. Roberts, for this wealth of knowledge and expansive presentation. And thank you, attendees, for joining our event. Today, we learned about liver cancer risk factors in the Black and African American community. To learn more about liver cancer and liver health, please visit loveyourliver.us. Please prioritize your liver health and go see your doctor for a regular checkup. Talk to your doctor about any risk factors for liver cancer that you may have. Thank you so much for your time. Have a lovely day and weekend.